Hello and a very warm welcome. What would a world look like without the laughter of a child? That naughty chuckle? Twinkling eyes that tell you they are up to something? The innocent wonder about everything in life that their carefree spirits discover. It is not without a reason that us adults so often fondly remember our own childhoods. But sometimes life isn't kind, and our little ones may also endure hardships. Their health gets compromised, leaving parents worried and anxious, and obviously the next stop then is a hospital or a clinic. Let us all never forget that hope sustains life. And with this spirit, Rainbow Children's Hospital, India's largest group of hospitals for pediatrics, presents a unique podcast series, Rainbows of Hope, in association with Earshot. I'm your host Mugdha Kalra, and in this series I will bring to you conversations with some of the best pediatricians in the country from Rainbow Children's Hospital, who are no less than magicians for our children. Each episode will look at a medical condition, and we will get the opinion of a super specialist on it. These episodes are Rainbows of Hope. So let us begin. In our first episode, however, we are going to talk about not a disease, but a neurodiverse condition, autism. Autism is on a rise, and the umbrella term used here is autism spectrum disorder. ASD is a developmental disability caused by differences in the brain. It can cause social, communication, and behavior changes. It is usually marked by restricted, repetitive patterns of behavior, which may also appear with sensory issues. You start seeing the symptoms, also called the red flags, as early as 18 months. It is a lifelong condition that can be managed with therapeutic intervention, medical support, and of course, a holistic lifestyle supported by acceptance and a deep conviction that your child is capable of living a happy, healthy, and independent life. Well, isn't that the most important thing we hope for our children, whether neurodiverse or neurotypical anyway? So joining me today to talk about autism and interventions available, the most sought-after pediatric neurologist, Dr. Lokesh Lingappa from Rainbow Children's Hospital, Banjara Hills, Hyderabad. Before we get into a conversation with him, let me tell you that after completing his DM Neurology from NIMHANS, Bengaluru, Dr. Lokesh pursued his passion to further pediatric neurology training and completed MR CPCH from UK and was trained at Birmingham Children's Hospital, Bristol, UK. His efforts over a decade have culminated into the presence of pediatric neurology departments across all the branches of Rainbow Children's Hospitals. Welcome to Rainbows of Hope, Dr. Lingappa.
Thank you. Dr.
Lokesh, my first question to you is, pediatric neurology is a super specialization, right? And mostly with developmental delays in children, one approaches a pediatrician. But autism is a neuro condition. So how does a parent know who to reach out to? Or simply put, when should a parent reach out to a pediatric neurologist?
Yeah. So a child who is having speech delay, difficulty in socialization, not having eye contact, not recognizing parents, as you mentioned already, repetitive restrictive behaviors. These are the things which will be a red flag, what we call as deviation in the normal development. A pediatrician is the first point of contact. A pediatrician will usually either refer to a developmental pediatrician if somebody is around, a child psychiatrist who deals with it, or a pediatric neurologist who also can handle these conditions. A pediatric neurologist definitely needs to be referred if there is a regression of milestones, that is something has acquired and they have lost it. There is epilepsy, there is visual disturbances, or a hearing impairment associated with that, then a pediatric neurologist has to be definitively consulted.
So, doctor, should we say that when the manifestations become physical and when there is regression, one should be reaching out to a pediatric neurologist?
Epilepsy, yeah, and epilepsy maybe, yeah.
Another question that a lot of people ask us is on the role of medication and role of medication in the intervention. In fact, pediatric neurologists and psychiatrists and pediatricians are the only ones who can actually prescribe medicine and not a therapist or a counselor. So,
Yeah.
what must parents bear in mind when they are thinking of medication? Because a lot of parents also feel that the child is so young. How can the medicine process of medication start? What should be the
Yeah.
interval? Will they wean off? A
Yeah.
lot of questions when it comes to medication.
Absolutely, absolutely. I think as a parent at that age, you are already dealing with one huge condition, and somebody says you can try this, and when you go on the net, there are so many different opinions on each of it. It's a confusing thing for the parents. Rest be assured, most of these medications are transient. There are some target symptoms. Then only we start medications. The target symptoms are if you are hyperactive, the child is not being able to controlled by the therapist by self. You have started therapy, gone on for 3 months, is not paying any attention. So there is significant hyperactivity. So there are medications to just make them a little bit calmer so that your therapy, your time spent on therapy is effective. So there are medications like risperidone, which is FDA approved beyond 2 years of age. There are medications called clonidine, which is also used for hyperactivity. Most of the times we use it only in the night because they have sedative as a side effect. Apart from that, you can use atomoxetine, which is beyond 4 years of age, and methylphenidate, which can be used beyond 6 years of age. So there are certain age group has to be considered while using particular medication. So that has to be put at the back of the mind. Yes, what is the age of the child? What medication is approved for that age? And this is for the attention deficit hyperactivity part of it. This is one of the most common indication for medication in children with autistic spectrum disorder. Apart from that, other target symptoms are sleep disorders. That's another most common issues these children face. And melatonin is the safest thing. It is a natural hormone and it is not addictive and safely can be used. Works in most of these children. Some children don't benefit, then we might have to think of other things. Although the melatonin is used along with other sleep inducing measures like not much of disturbance in the surroundings in the sleep time, reduce dimming the light, no sounds, maybe setting a regular routine to them that yes, this starts by the time my lights get dimmed, you start singing a lullaby or doing some particular music, rocking them to sleep. So a pattern starts setting in. Try those things. If that doesn't help, then add melatonin. So melatonin also can be weaned off very safely. Absolutely not an issue at all. So those are the two common indications of medications. And there are supplements which have been tried, like omega-3 supplementation, L-carnosine. They are also safe. To certain extent might benefit and usually are tried for around 4 to 6 months. If you benefit from it, you continue. If you don't benefit, you can always stop. So as a parent, I can assure you, you don't have to be worried about whether it's going to be lifelong. None of them are. None of the medications, even if the anti-epilepsy, anti-seizure medications are started, we try to wean it off in 2 to 3 years' time.
That is so reassuring, Dr. Lokesh, because I have a personal connect with autism. My son is on the autism spectrum, and we hesitantly started medicines about 3 years back. But I must tell you and also share it with the parents who are listening that under a doctor's supervision, if the medicine is prescribed, it can do wonders for a child. And I have seen with my child, whether it was Inspiral, Diva, Risdon, all the medicines have taken time to sort of adjust with the child's body. So we did have the first 1 week or 2 week of sleeplessness or weight gain. But believe you me, the side effects also the doctors prepare you with, and with time you get used to handling the medication as well. But one of the things about medication, Dr. Lokesh, is also that a lot of parents will ask if your child has gained from this medication, can I start this medication? I think whether to give medication and whether to wean off from medication is also like a doctor's job, and I don't think people should take that call on their own.
Yeah, I think it's very intelligent, interesting situation. Many parents, they are very learned and they talk to each other always and they say, see, my child benefited from this. Why don't you use on your child? So some parents actually come back, take a consultation and ask. Some very rarely start on their own. I think it is not a good idea because each child is unique. Your child's problems are unique. The same thing might not work well. The comorbidities, like somebody is obese, and the same medication might not be good because it might make you put on weight. Somebody is very lean, Inspiral makes you go off the diet. It reduces your appetite, the methylphenidate. So you cannot choose the medication unless you are consulting a specialist and saying, yes, see, this medication for this comorbidities and your problem works well, whereas the other one may not suit you well. So have a debate with your doctor and then start the medication, not by the word of mouth of your parent. What works for another child may not always work for your child.
You are listening to Rainbows of Hope, a unique series on childcare by Rainbow Children's Hospital in association with Earshot.
Dr. Lokesh, you mentioned a very interesting point about the sleep issues. And
Yeah.
us individuals also, and us adults and neurotypical children also, when we see a sleep deprived human being, we can easily make out that they will not be able to concentrate on anything.
Yeah.
But with all of us, it's a one-off. But with
Yeah.
children on the spectrum, sleep comorbidities sort of come together. When should one be looking at supplementing it with medication? Like, when is that point where you tell your doctor or reach out to a doctor that, all right, now I can't handle it on my own and the sleep issue needs to be fixed?
Yeah. So when you have had a good routine, so I think setting off your routine through the day is very important. They don't sleep excessively during the day. So if they sleep not more than an hour during the day, not beyond 4 in the evening. So if you're sleeping beyond 4 in the evening, obviously your nighttime sleep will be put off. So try to make sure they sleep and wake up before 4 o'clock in the evening and not more than 1 hour at a stretch as much as possible. When they are very young, it's very difficult, but beyond 3 years, I think you can probably set that time limit. And that is one thing very helpful. Second thing, most of these children on the spectrum are quite hyperactive and they burn their energy. But if somebody is not active, trying to get some activity in the evening hours between 6 to 8, if you get them physically active, and don't give any stimulant kind of syrups or medications in the evening hours. There are certain medications which can make you very active, like example, methylphenidate or something like that, or atomoxetine. They can actually stimulate you. So don't use those kind of medications in the evening. And then set a routine, as I already mentioned. So set a routine so that the brain gets used to that routine. Once they start step 1, 2, 3, like dimming of the light, and you give some lukewarm milk and then tap them to sleep, and that is the routine over a period of time. If you set, generally it helps. And if there is any constipation, treat it. Make sure he is well fed before going to bed. All those things are taken care of. In spite of that, he is not falling asleep. He is spending 2 hours tossing, turning around, getting irritable. That's a point I would say that melatonin would help.
Great point, sir. When we talk about interventions, we always look at holistic intervention. And I tell you, sir, in my experience of 7 years, it's rarely that you find a place where you can find your pediatric neurologist, your developmental pediatrician, your therapist. So it's always such a maze for parents going from one place to another. And wouldn't it be lovely if you find all of this at one place? And I'm guessing Rainbow does a fantastic job of it. But what are some of the holistic approach of interventions that you suggest? And how do you suggest a parent decide what therapy needs to be prioritized at this point in time?
Yeah, I think that's a very important question because most of the parents, after diagnosis, they are lost. It's a shock for them. And it's very difficult to take that situation. And at this point, I don't want to forget mentioning this. I think as a parent, what they go through, it's godliness. Because it requires superhuman effort to look after these kids. And we all respect it so much. I always tell my students, if ever you lose patience, look at those parents. and take that, and nobody actually loses their patience. And my students, they
I
know that,
totally agree, sir. I totally
yeah,
agree with you.
it requires superhuman effort to look after, and it's something always inspires me to actually keep on working and somehow make their lives better. Okay, so I think going ahead, once the diagnosis is done at the very young age, trying to get their attention is what is important. So occupational therapy is the initial part of call, not the speech therapy. So once the attention is better, the child is able to listen to you what you are telling with the occupational therapy, making them concentrate on things. Then maybe over 3 to 6 months after starting occupational therapy, you can add speech therapy. Once they start moving towards 3 years of age, I start looking at whether they can hold a pencil, whether they can sit in a classroom and do activities. So that is something a special educator will start coming into the picture. So occupational therapist, speech therapist, 3 to 4 years of age, a special educator, and then at that time start looking out for schools which can accommodate these children depending on their ability to sit in a class, not disrupt the classroom, and not injure others. So these are the few things where people have to look into. I just hope as a community of schools and the government as such, it's getting better, but nowhere it is enough to accommodate all these families, all these children in a very conducive manner to facilitate their development. I think that is one thing as a community and the state, we should work towards supporting the school part of it.
You are listening to Rainbows of Hope, a unique series on childcare by Rainbow Children's Hospital in association with Earshot.
One of the questions that is really boggling the minds of parents at the moment is about stem cell intervention. What is your opinion on it, sir?
Yeah, I think there is not even a single day goes by without discussing about this in the consultations. In fact, today morning we had a video consultation of a family from Tamil Nadu. One of the pediatrician asked, "Why don't you check with me?" Because I had given some talks in national conferences. So the it's always based on science, but currently it is based on hope. So you can understand that point, that most of the stem cells today done for autistic spectrum disorder are based on hope rather than science.
That's a good point.
Yeah. So if you have the evidence, you have to look at scientific evidence. The robust evidence is what is called as controlled double-blind control studies, which has been done by Duke University of around more than 70 children in different arms using umbilical stem cells. And what they have concluded at the end of it is, it has not much of difference between the three groups. One where is a placebo, where nothing was given. Other one was the umbilical stem cell transplant was given of their child's own autologous, what we call as autologous stem cell. So at this point in time, if you go for evidence, yes, there is not much of difference. But many of our families, as we all know, because it's such a desperate situation, we don't blame. People travel anywhere. I think there are groups of going to Panama, going here and there, spending whatever is required. It's just, as I said, on the hope that something will help. There is improvement of maybe 5%, maybe 10% in some children. Even that is not possible in some of these children. After 3 or 4, some families have got 3 or 4 stem cells done sessions. In spite of that, they have found very minimal improvement. One thing I can say, it's not a cure, that everybody should be aware. There is no 50%, 90% improvement. What we have seen in some of these families who have got it done is there might be 5% or 10% improvement in the understanding, their independent skills. That has happened. So there are different.
It's not a magical wand in any way.
Absolutely. Not with the technique as of today, and what we are giving as of today, it is not a magical wand.
You are listening to Rainbows of Hope, a unique series on childcare by Rainbow Children's Hospital in association with Earshot.
So last question. We still don't know the exact reasons for autism, but is there something that we can keep in mind to reduce the chances or severity of occurrence? A lot of times people find it after, of course, they have their children. But is there any research or experiment that is telling us conceiving?
whether we can reduce it,
Yes, sir.
it's a big thing actually, and very important thing. Currently, the reasons for it, as you go through the literature, it's a combination of genetic and the environmental factors, not just genetic. If you look at the twin studies, if there are two twins and if they are monozygotic, they are 90% chance of having autism. If they are dizygotic, their chance of having autism in both the children is drops down to less than 10%. So, which means that there is a huge genetic component, but there are a lot of environmental factors as well. So, I think the pregnant mother should be made aware throughout the world that they should be making sure that when the child is born, they should be surrounded by people. They should be keeping on talking to each other, environment where the baby is going to listen to thousands and thousands of words on a spoken words on everyday basis with emotions in front of them, not necessarily to them, in front of them or surrounded by them. And this is possible when you have either extended family in the form of grandparents or some support system, whatever can be possible in each family. I think that will be a great this one. Limiting the digital time until they are 3 years, I would say no digital time. You might give for 15 seconds, 15 minutes when they are feeding them, but not into the child's hand. You hold it, you control everything, you just show them a little bit during the feeding time. That to don't, as far as possible, not to introduce before sort of 2 years of age until you are made sure they've had a good language. So there are many pre-digital era, everybody used to feed their children. They used to grow well. So it is not that is the only way we can do it. Just get them out of the window, get them out of the door into the balcony or wherever, show them the world around and then feed them. But I think stopping that is one of the way, and making sure that they get exposed to a lot of spoken words and emotions when they are growing up. And those are the things which actually might help. It's not that mother is homemaker, that's fine, she can look after, doesn't work. Because mother has so many other things to do, she has somebody else to be there to talk to her. When that happens, these things might reduce. It's one of the, from thousands of families we speak to, one of the things most of the parents feel bad is maybe I gave them more time because both of us were working from home with this COVID, and both of us were working. We left them in front of camera, the TV or the mobile, and then now we see they have regressed or they're not speaking. So I think there is some inclination for us to say, yes, you change this, there might be impact, might be less, but this education should happen probably when they are pregnant, and the family should be made aware. These are the things how we should take care.
Well, thank you, Dr. Lokesh, for all those wonderful insights and taking out time for us. I'm sure our listeners have gone back more aware and also much more hopeful after listening to you. Parents and near and dear ones of young hearts listening to our podcast, remember we have got Rainbow 1 for complex and critical cases. For any such cases in children, visit rainbowhospitals.in or call at 888 2046 046. I repeat that, 888 2046 046. That's it for now in our very first episode of Rainbows of Hope. In the next episode, we will talk about pediatric blood disorders and how to manage it with Dr. Nandini Hazarika, a specialist in child hemato-oncology at the Madhukar Rainbow Children's Hospital, Delhi. Tune into Earshot on www.earshot.in. You can download the Earshot app from the Google Play Store. Our podcasts are also available on Spotify, Google Podcast, JioSaavn, Apple Podcast and Gaana. Stay happy, healthy and always hopeful.